Disease overview. Rothmund Thomson syndrome, RTS, is a rare genetic disorder that can affect many parts of the body. Patients typically begin having signs of RTS during infancy, and the first feature to appear is a rash that starts on the cheeks and later spreads to other parts of the body. Signs and symptoms. Rothmund Thomson syndrome is a rare genetic disorder that manifests in early infancy. Intelligence is usually normal, but some affected individuals have been reported to have intellectual disability. Skin and hair between the ages of approximately 3 to 6 months. Infants with RTS typically develop redness, erythema, on the cheeks that may appear as patches or inflamed plaques and may resemble sunburn or even eczema. Over time and usually by early childhood, the inflammation tends to recede and the skin of affected areas develops into a more chronic pattern of rash known as Poikiloderma. Characterized by telangiectasis, prominent, small, spider-like blood vessels, small, spots of atrophy, skin tissue degeneration or thinning, and areas of abnormal skin pigmentation alternating between increased pigment, hyperpigmentation, and decreased pigment, hypopigmentation, giving a lacy, web-like or mottled appearance. Sensitivity of the skin to sun exposure. Photosensitivity has been reported in some patients, and the rash tends to affect areas that are more sun exposed. Some affected individuals report a history of blistering, bullae, on the skin that may or may not be related to sun exposure. Causes. Rothmund Thomson syndrome is a genetic disorder that is inherited in an autosomal recessive pattern. The RECUL4 gene is responsible for production of a protein that is involved in the replication and repair of DNA. The genetic material in the cells of the body. Affected populations. RTS has been diagnosed in people of all races and has been described in multiple nationalities. Therefore, it does not appear that there is any particular population at increased risk for developing the disease. Disorders with similar symptoms. RAPADILINO syndrome is an autosomal recessive genetic condition that is characterized by abnormal skin pigmentation, but not poikiloderma, small size, radial, ray defects of the bone, abnormal palate, absent or poorly developed kneecaps and gastrointestinal abnormalities. These patients are prone to developing lymphomas as well as osteosarcomas. Barler-Gerald syndrome is characterized by small size, radial ray defects and other bone abnormalities, including premature closure of the bones of the skull, craniosynostosis. Bloom syndrome is a rare genetic disorder characterized by short stature, increased sensitivity to light, photosensitivity, multiple small, dilated blood vessels on the face, facial telangiectasia, often resembling a butterfly in shape. Immune deficiency leading to increased susceptibility to infections, and, perhaps most importantly, a markedly increased susceptibility to cancer of any organ, but especially to leukemia and lymphoma. Bloom syndrome is inherited in an autosomal recessive pattern. Opening parenthesis. Diagnosis. Rothmund Thomson syndrome is diagnosed based on the onset, appearance and progression of the poikilodermatous rash. Thus, a negative test does not rule out the diagnosis of RTS, but a positive test confirms the diagnosis. Specific therapies for the treatment of RTS are symptomatic and supportive. Special measures may be recommended to protect affected individuals from sun exposure, e.g., use of topical sunscreens, sunglasses, etc. In addition, because some individuals with RTS are more prone to developing certain non-skin related malignancies, e.g., osteosarcoma, than the general population, physicians may closely monitor affected individuals to ensure early detection and prompt, appropriate treatment. Effective therapies for osteosarcoma and other cancers are currently available, and it appears that some patients with RTS can tolerate these therapies similar to cancer patients. In the general population, RTS patients may be at risk for osteoporosis and bone fractures. Monitoring with DXA scans may be warranted and some patients may benefit from bone supplements. Thank you for watching. Please subscribe for more videos. Your like, comment, and share always motivate us.